recording. All right, well, let me begin the program. As the coronavirus pandemic circles the globe, it's becoming clear that some of the worst hit places are care homes. According to the World Health Organization, this pandemic has shone a spotlight on the overlooked and undervalued in all corners of society. In data collected across Europe, roughly half the deaths related to COVID-19 have occurred in nursing homes. A recent analysis of federal inspection data found that as many as 75% of US nursing homes have been cited for failing to properly monitor and control infections in the past 3 years, a higher proportion than previously known. In the United States, the first known cluster was at the Life Care Center of Kirkland, a federally 5-star overall rated nursing home in Kings County in Washington State, from which staff transmitted the virus to other care homes in the area. Care homes for older people are struggling to cope with the pandemic, prompting allegations of inhumane treatment and calls for high-level inquiries. In California, authorities even urge people to remove their relatives from care homes whenever possible. A combined lack of preparedness, inadequate testing capacity, and early misunderstanding of how the virus could spread has brought death to hundreds in nursing homes across the country, where patients often died without family and loved ones at their side. It's important that patients and their families have the information that they need, and they need to understand what's going on in their adult facility. Please give your attention to John McDermott, Hawaii's long-term care ombudsman, as he addresses the situation here in Hawaii, and his colleagues. And if you have questions, please send them via Zoom chat or Kokua Council's Facebook. John, please take over, and I'm going to unmute Jackie. Jackie, I'm going to unmute you, and Hugh is unmuted. And let's see.
Brent and Lynn.
Okay, Brent is why does Brent, you have to unmute from your side, I think. No?
Here we go.
I will unmute when it's time. I have noisy little dogs, so I'm going to stay muted for a little while.
All right. Let's see now. So I have Jackie is muted. I have Brent, Hugh, John, and this must be Lynn. Lynn, are you there?
Hi,
Lynn,
I'm here. I also have kids at home who are on webinars, so I'm going to remain muted too. Thank you.
Okay, so please unmute yourselves when necessary. Okay, John, the show is yours. Thank you.
Okay, thank you very much. So just a quick introduction. So Lynn Itani is our volunteer coordinator, and Jackie Gardner is our contracted ombudsman for the Hilo side of the Big Island. She was a public health nurse for about 40 years, and she's a nurse practitioner. And Brent Fremont is our ombudsman for Maui County. He started out as a volunteer, and so he's right now contracted. And then Nash Keel is our ombudsman for Aloha Rehab, and in a previous life he was also a nursing home administrator. So great experience, and we appreciate all of their help. So anyway, I want to begin just by noting something that LILA said, that people often mistake. They use care homes and nursing homes interchangeably, and they're two totally different things. And so this is what I think confuses the public, because newspaper reporters get this wrong, television stations, they use those terms interchangeably, and they're not. So the reason I wanted to do this presentation was because most of the attention from the media has been on nursing homes. And in most states, there are more nursing homes than there are boarding care homes. So in some states, they don't use the term adult residential care home like we do. They call them boarding care. And also in some states, anything that's not a nursing home is called assisted living. So again, that makes it very confusing, because we're not all using the same terminology. So Hawaii is a little bit different, because we actually have more beds out in the community than we have in the nursing homes. So Currently, our nursing home bed count is about 4,492. I didn't say 4,492 residents because I don't know if every one of those beds is full. So 4,492 beds in the nursing homes. But the assisted living facilities, the adult residential care homes, and the community care family foster homes total 8,397 beds. So twice as many. So why is it that the nursing homes are getting all of the attention and a lot more help when we actually have more of our seniors out in the community, and it seems like those folks are getting very little help at all? I wanted to just give updated numbers now as of Sunday, April 26th, according to the Star Advertiser. It said that Hawaii has 606 coronavirus cases. I know that that just increased by 1 today. And of those 606, 7 of those residents were diagnosed outside of the state of Hawaii. We're lucky we've only had 15 deaths, so that's pretty low. And by island, it's 396 cases on Oahu, 112 on Maui, 70 on the Big Island, Hawaii County, and 21 on Kauai. Why we're concerned for our seniors is because of the hospitalization rate. So in terms of age group, from 0 to 19, we've only had 26 cases. From age 20 to 39, we have 191 cases, and 3.5 of those, 3.5% had to be hospitalized. And then the largest group, from 40 to 59 years of age, we've had 198 plus 17 that had to be hospitalized. So those 17 are 7.9%. With the seniors 60 and older, we've had 123 cases, but 44 that had to be hospitalized, and that's 26%. So 26% versus 3.5%, 7.9%, it's a big jump. So when seniors get it, this can be very lethal. And so that's why we're so concerned about keeping this virus outside of all of our facilities. The paper said that 317 of those cases were travel related, 224 were community spread, and maybe because they knew somebody who had traveled and then they spread it among their family members. 65 origin is unknown. So the good news is of the people who did have coronavirus, 80% recovered. That's much higher than anywhere else. 488 patients, 80% recovered. And we've done 28,091 tests, and only 2.15% were positive. So we, Hawaii and Montana, are the lowest in the United States. So that's good. Okay, so issues that the long-term care facilities have been bringing up to my attention and have asked for help. And I've also talked to AARP about this because they wanted to draft a letter to Dr. Anderson, who's in charge of the Department of Health, regarding the care homes, foster homes, assisted living. So first on the agenda is the annual inspection really essential during these COVID times? So there was a memo that came out on March the 4th from the Centers for Medicare and Medicaid Services. And CMS is the federal agency that licenses all of our nursing homes. They have nothing to do with the community-based facilities, only nursing homes. And they told the surveyors that surveys should be suspended at this time, except for immediate jeopardy, where it's a really serious concern, or if it's a complaint about infection control issues. So this is to reduce the numbers of visitors who are coming into the facilities. Clearly, the fewer people coming in, the less opportunity for the virus to come in. So that's the way it's supposed to work. And so one gets the impression that our Department of Health maybe has one policy for the nursing homes and then a different policy for the care homes, foster homes, and assisted living. We did get a phone call from an administrator of a 8-bed care home. And early in the morning, 3 surveyors showed up wanting to come in, and he refused to let them in. They were not wearing any kind of personal protective equipment. And he felt that with COVID COVID-19, why don't we just wait until the annual inspection is over? Surveyors, of course, upset about that. They called up their supervisor, Keith Ridley, who spoke to the administrator and basically said that if you don't let the surveyors in, then your license may be revoked. So this administrator did send a letter on April the 15th to our Attorney General protesting that tactic and also feeling that the residents were put at risk. So this is one of the questions that our facilities are asking. Why are you coming into the home now? Everybody is struggling to do the best they can. In a nursing home, you're not going to be able to observe the activities program because there's no activities. Everybody's in their rooms. You're not going to be able to observe the communal dining room experience because everybody's eating in their rooms. There's just a lot of things that normally take place that have been suspended. And so shouldn't these annual inspections be suspended as well until everybody feels that it's safe? So, and I do have all of this in writing, including the links to the CMS memo. So this can be available after the talk if anybody wants to take a look. But from the CMS memo, it says specifically, CMS is suspending non-emergency inspections across the country, allowing inspectors to turn their focus on the most serious health and safety threats like infectious diseases and abuse. This shift in approach will also allow inspectors to focus on addressing the spread of the coronavirus disease 2019, COVID-19. Okay, so that's a big issue. Okay, now the second issue is, of course, what we all know, the personal protective equipment. So if you are a nursing home, you remember the Healthcare Association of Hawaii, and they may be helping you in obtaining masks and gloves and gowns. But we found out from the care homes and the foster homes that nobody is helping them. So they have to wait online like you and I at Costco or Sam's Club and try to find this stuff. And they're first responders. They're putting their lives at risk, and their children and their spouses, everybody who's living in that home. And so you would think that the Department of Health would do something to expedite this, but instead the impression seems to be that you're kind of on your own. And actually, I should let Jackie jump in here for just a second, because Jackie had a very personal experience with this in trying to advocate for some of the caregivers on the Big Island. So Jackie, you want to talk about your email?
Oh, well, because we are making telephone visits as ombudsman instead of personal visits, I was asking them what they had for supplies. Some of my foster homes and care homes are having difficult times obtaining gloves. Some of their supplies are running low, and that's just for everyday care, not necessarily anything related to COVID. If you have to change a diaper or a bed or something, they usually will wear gloves. Some of them kind of planned ahead and bought extra. And then I'm finding that many of them do not have any N95 masks, which probably John will address in a bit. But so back to my email thing, I got something, somehow we got a letter from Justin Lamb about something. I can't remember. John, do you? What the beginning Justin Lamb letter email was?
Well, he said that basically.
I remember his reply, but I don't remember how I started.
Yeah, you were advocating on behalf of the homes that have asked for help, and he said that if he had masks to give out, he would, but he doesn't. And you know, their role is regulatory, and so they're not able to help. Now, Justin Lamb is in charge of the Office of Healthcare Assurance, the part that does the care homes, the foster homes, and the assisted living. And we understand that, you know, that their role is regulatory, but he's also part of the Department of Health. And that's really the issue that we're trying to focus on here. Where is the Department of Health in helping these folks? You know, we haven't had a pandemic since the Spanish flu, so unless you're more than 102 years old, you have no memory of going through a global pandemic. And so these homes are saying, you know, I don't know what to do, and I'm not really getting much guidance from the Department of Health. And CMS sends out tons of information to the nursing homes because they are in charge of the nursing homes, but they don't share that information for the smaller homes. So these smaller homes are saying that, you know, can we buy our gloves from the same places that Halinani does, that Aloha Rehab does? And they're told no, because you're too small. So I'm trying to make sure my phone doesn't ring, so sorry about that. So anyway, they're told that they're too small, and so they just have to wait online like everybody else. But that means that when the caregiver is waiting online to get into Costco or Sam's Club, she has to have a substitute caregiver, and substitute caregivers cost money unless your spouse is the substitute caregiver, and we can't assume that's always the case. And you know how long it takes to get into Costco nowadays. So you're just wasting an awful lot of time. These folks should not have to do this. So again, what we're trying to say is that if you're in a nursing home, your level of care is either skilled nursing or intermediate care. If you are in a community care family foster home, your level of care is skilled or intermediate. If you are in a community care family foster home or an expanded adult residential care home, it's the same level of care as a nursing home. So these residents are equally vulnerable, but one group is getting some attention and the other group seems to be getting very little. And so we want to change that. So
I think they might be more vulnerable, John, because at a nursing home, you have a nurse somewhere. And
Right.
and I'm not trying to be nurse centric, I'm sorry. But sometimes in a foster home or a residential home, you have a CNA.
right. Good point. Good point. Hawaii is better than most states in that the federal law says that for the nursing homes, federal law says you have to have a registered nurse for at least one shift. In Hawaii, we require at least a registered nurse for all 3 shifts. So there's always an RN on board. You have 3 shifts so people don't get burnt out as much. You have lots of professionals with college degrees and beyond. And if you're in a care home or a foster home, you don't have staff. You're doing it all by yourself. You don't get a day off. You don't get holidays. You don't get to take off for your birthday. You're on 24/7. And now you're also trying to babysit your kids and help them with their homework. And maybe your spouse has lost his job, and so not a happy camper. A lot of pressure going on. And now to add to the pressure, you got to go find your own personal equipment, you know, by yourself. So this really is not acceptable. Okay, so the other thing that I wanted to mention is that I know that we've all seen Dr. Anderson on multiple times on TV say that if people are sick, they should stay at home. Caregivers who are foster home operators, care home operators, they are at home. So if they're sick, we have a real problem, because how would they isolate themselves from the rest of their family? These houses are not usually large homes. This is a regular size house with a lot of people inside the house because nobody's supposed to be leaving the house. And if they get sick, they don't want to contaminate the residents and their family members. But who picks up the slack if they're in bed trying to recover from this flu, and now you don't have anybody really providing the necessary care? So this is another reason why we have to be so careful that we keep the virus outside, that it never enters these smaller facilities, because the consequences are very, very serious. Visitation policy. Okay, so it seems that Department of Health is not being very consistent about what is the visitation policy. Are you supposed to ban all visitors, or can you have them? I talked to different facilities and they all have different policies. And how is that possible? because they're not getting anything from the Department of Health. So a woman called me up. Her mother is 97 years old, and she's in a community care family foster home. And she was very surprised that both the caregiver and the case manager said that she could visit anytime she wants. Now, of course, she's thrilled that she can visit her mom, but she was also worried that there's 2 other residents who also have family members who are visiting. And she doesn't know if those family members are as conscientious as she is about washing her hands and wearing a mask and not bringing any germs into the facility. So she's really afraid that her mom could be at risk because this caregiver is allowing other folks to visit as well. So that could be avoided if the Department of Health would give some very clear directions on what is the visitation policy. The Centers for Disease Control has a very clear policy. It says because of the ease of spread in a long-term care setting and the severity of illness that occurs in residents with COVID-19, facilities should immediately restrict all visitation to their facilities except for certain compassionate care reasons such as end-of-life situations. So they give a whole list here. Send letters to the families advising them that no visitors will be allowed in the facility except for certain compassionate care cases. Use alternative methods of visitation like video conferencing. Post signs at the entrance of the facility advising that no visitors may enter, on and on. Our program, the Ombudsman program, we decided that we would not go into the facilities. And then later on, it was agreed upon by our national association and by CMS that ombudsmen are not allowed in facilities. So we, of course, would not want to be responsible for bringing in any kind of a virus. But the downside of that is we don't really know what's going on in our facilities right now. And when we get these daily counts of people who are sick, and a number of them are seniors, they report that, this person had been sick in a hospital for the last month or 2. What they're not reporting was that person in a nursing home before they went to the hospital. Were they in a care home or a foster home before they went into the hospital? So we're not really getting the full picture. And so we may have the impression that everything is going well in our long-term care facilities, and we really just don't know. Okay, so another issue that we are concerned about is that we do have a lot of caregivers who have multiple facility jobs. Being a CNA, a certified nurse aide, is a very hard job. It is not a very high-paying job, and the cost of living in Hawaii is pretty extreme. So we do have a lot of CNAs who end up having to work at 2 facilities. And so when you go from one facility to another, they may be taking your temperature to see if you have any kind of a fever, but we know that this virus can also be on your clothes. And as far as I know, we're not requiring that people change their clothes as they go from one facility to another. And it can be on your clothes up to 3 days. So that is, a concern. Do administrators even know which caregivers are working in 2 different facilities? So you can have one facility where COVID-19 has broken out, and then that same CNA is now coming into your facility. And if you knew that she's coming from a facility that has the virus, you might not want her to come into your facility, or you might want to insist that she first be tested, and not just a temperature test, but the actual test. So that's an issue that we have to be careful about. COVID reporting, so this is very brand new. So CMS only recently is now mandating that nursing homes have to report if any staff or any residents have the virus. So believe it or not, that was not a requirement. And it still hasn't really gone into effect yet. But as I mentioned before, CMS only deals with nursing homes. So, how do we get the Office of Healthcare Assurance to also require this of our care homes, foster homes, and assisted living facilities? So we're never going to really know how widespread the problem might be, or if there are clusters. We know of the cluster at Maui Memorial, but we don't know about others because we're not really getting that information, or it's not being told to the public. Again, the announcement from CMS about the testing, I do have that website, which I can share with all of you when we pass this out. Testing, okay, so a lot of our caregivers are very reluctant to admit somebody to their home unless that person is tested to see if they have the virus. Because if you're bringing somebody into your home that has the virus, most of our facilities are small facilities. They're not private rooms. You're going to have a roommate, and the rooms are not that large. So if you've got the virus, most likely your roommate is going to get the virus, and maybe other people in the house as well. So that's one issue, you know, that how can we prevent people coming into a smaller home, whether they're coming from the hospital or coming from a nursing home. Caregivers would like to have these folks tested to make sure that they don't have the virus. And then testing itself, you know, we have had multiple testing sites, but you have to go in your car and get online and wait your turn. And doing that when you have 3, 4, 5 residents, some of them in wheelchairs, some of them using oxygen, some with maybe a mental illness or dementia, trying to put all of those people in the car or in the van, that is not going to work. That's going to be a real problem. So we need to figure out how we can get some kind of, you know, portable vans that can go to these homes and do the testing in the home so that you don't have to be dragging all of these residents out to the site. It's just very difficult to do that. So we've seen in the newspapers that they keep saying regarding testing that nursing homes are a high priority. But again, the care homes, the foster homes, assisted living, they should be equally high priority because they are taking care of vulnerable seniors, and these caregivers are also first responders. And so they should be given the same respect and care. A most recent issue is the wearing of shoes inside homes. So Community Ties of America is the agency that has the Department of Health contract to go into the foster homes, and they license the case management agencies and they certify the foster homes. And recently they sent out a letter, and this says shoe removal, effective immediately for safety and sanitary purposes. CTA staff will no longer remove shoes before entering a home. CTA staff will wipe their feet off on any home mat when one is accessible. This is to protect our staff and the people in your home. The medical community is advising against using disposable shoe coverings. OSHA requirements recently reviewed instruct that our staff need to keep their shoes on for their safety. We understand the cultural significance and hope you understand that a community care family foster home is a business, and since we do not remove our shoes upon entering a nursing home, grocery store, or any other business, we can no longer do so in order to comply with regulatory requirements that govern our employees. We also want to ensure we are not using PPE that other essential workers really need to use. This, as you can imagine, is very offensive to the care homes and the foster homes because yes, it is a business, but it is also a personal home. They live there. And, you know, anything that you coughed up or you spit or whatever, you know, gravity, it hits the ground, it gets on your shoes. And the idea of people bringing in dirty shoes into somebody's home, when we're talking about infection control, you know, trying to up our game here on infection control, this is just the total opposite. So the caregivers have petitioned Department of Health, and I think they've contacted CTA and they've contacted Representative Mizuno to get this policy reversed because it just doesn't make any sense at all. So Keith Ridley, who is the chief for the Office of Healthcare Assurance, he did respond to concerns about this on April the 15th. And unfortunately, what he wrote here says, wearing shoes in homes is a recent behavior because of safety concerns for the inspectors. Licensed or certified care homes are also places of business, and they are the job sites for inspectors. Wearing shoes is a safety issue to avoid injury from sharp objects, falling objects, or slips and falls from wearing socks only. Nevertheless, DOH will work with CTA on this issue. However, with booties in apparent short supply, booties may be difficult to immediately obtain, and annual inspections to renew certifications or licenses must continue and are critical to ensure the health and safety of clients and the public, and especially to ensure that caregivers are practicing proper infection control techniques to prevent the spread of COVID. So kind of ironic that he's talking about, practicing proper infection control techniques, and at the same time, they're advocating their right to wear dirty shoes into somebody's home to protect the inspector's feet. So not at all consistent, and very bad timing too with COVID-19, to bring this up. So again, if you were a caregiver, if you had a care home or a foster home, would you really want to have to deal with this nonsense? Leaving the home. Okay, so now this is also a problem. There are lots of reasons why a resident or a family member has to leave the home. They have a doctor's appointment, they have dialysis, they have a dentist appointment. But every time somebody leaves the home, they have a risk of catching the virus and bringing it back into the same home. So what should the policy be when somebody returns? So should they be required to wear a mask indoors? Should they have to quarantine themselves for 14 days? We don't really know because, again, Department of Health hasn't really told anybody. They have not given any guidelines on what to do. Now, this was a fairly big issue over on the Big Island. The Regency at Hualalai is an assisted living facility, and it's both independent living and it's also assisted living. And they had some residents who were coming back from the mainland, and so they agreed to quarantine themselves for 14 days and stay in their room, and the food was brought to them. But there are other residents who are living on the independent living part, and they are still insisting that they have the right to come and go as they please, go into town, do a little shopping, whatever. And they don't seem to be taking this order seriously. So this is both the governor's order and the mayor's order. And the facility is saying, how do we stop these people? Can we have them arrested? Can we refuse to let them come back even though they've paid to stay here? Do we have a police car parked out in front? Should they be wearing a mask when they return? Because the assisted living part and the independent living part, it's all under the same roof. These people are all sharing the same common space anyway. So again, this is where some guidance from the Department of Health would help, because the administrator could post that letter, could put it underneath everybody's door, could say, there are going to be consequences if you violate this mandated order. You need to stay inside until it's safe, because otherwise you are putting yourself and everybody else at risk. And shame on you if you bring the virus in here and somebody dies because of your stubbornness and stupidity. Okay, now we're also supposed to separate people who we know are COVID-19 infected. Nursing homes, even large nursing homes like Halinani, 288 beds, that's a bit of a challenge. People do not like the idea that they have to move. So if you start having some residents with COVID-19 and the hospitals are saying, don't send them to us, we need to keep our beds available in case we have an onslaught of infected people, and you're going to be jamming us up. So you need to create your own little COVID-19 wing and move people around. And we've had families call up complaining about that don't you need my permission to move my dad? He loves that room, he doesn't want to go. CMS is saying that you should try to create a wing so that you have two separate staff, one that works with the COVID-19 folks, one that doesn't. So again, you're trying to minimize any cross-contamination. And if you have a facility that has another door that can be used as an entrance for the COVID-19 staff, that's ideal. But that means that some people might have to move against their wishes. And that's one of the rights that has been suspended. So it's only supposed to happen if it's absolutely necessary. And it's a temporary situation. When COVID-19 is gone, then everybody gets to go back to the rooms that they were in. So families just need to understand that, you know, these are difficult times and we have to kind of go with the flow. But in a foster home and a care home, much smaller, this is a much more difficult thing to do. You know, how do you separate these people, and what do you do if the hospitals refuse to take them? So this is a challenge, and these homes, you know, are looking to the Department of Health for some help. Okay, 1:43. So I'm looking at the time here. Okay, environmental cleaning. We know that nursing homes, they have professional cleaners, they have the best chemicals, and anytime somebody is discharged, that room is really scrubbed down. Well, in a care home or a foster home, that caregiver is everything, including, you know, the cleaning crew. And so she's going to do the best she can. And is it good enough? Well, we keep our fingers crossed that it is. But are they getting training? Are they getting help? Are they getting guidance on how to make sure that everything is sanitized when somebody is leaving and you're about to admit somebody new? Diagnosis, again, in a nursing home, you have registered nurses, you also have medical directors, so they know how to diagnose somebody showing signs of COVID-19. Care homes and foster homes, those caregivers might be just certified nurse aides. We already know that quite a few of them are from the Philippines. English is not their first language. So there are some things that might be difficult for them to understand. So where is the cheat sheet on how to tell if your resident may actually have COVID-19 and what to do about that? So Department of Health, where are you? We need you. Okay. Okay, interesting. Governor Cuomo was talking about providing hazard pay for all of the first responders. You know, our caregivers are so poorly paid, and many times they're paid months behind schedule. And so it would be wonderful if somebody was offering them some kind of a hazard pay. You know, I was told that we're supposed to be banging our pots and pans on Saturdays or something like that. Again, it's not just for the hospital staff, it's for all of the caregivers because they're all really putting their life on the line here. So those are the things that I kind of wanted to highlight. Again, only because I feel that the attention has been mostly on the nursing homes, and that's not where Hawaii is. Most of our long-term care residents are actually in the care homes, foster homes, and assisted living facilities. And so we've got to get the Department of Health to pay more attention, and maybe also the media to pay more attention, and you know, help these folks who are, you know, really struggling to do the right thing. They all want to do the right thing, but they need some help. Okay, so I better leave some time for questions. So, oh, by the way, I did ask Brent if he wanted to share anything about Maui, and Jackie also, Jackie mentioned a little bit, but if they have anything else that they want to say. Hugh has, his facility is Aloha Rehab, but he hasn't been going. So we have been trying to call facilities to ask them what's going on. And hopefully what they're telling us is accurate. I do have a couple of residents that I have called up who are in facilities. And luckily, so far, I've been told everybody is wearing a mask. Quite a few are wearing gloves. Housekeepers, social workers, dietary therapists, everybody is wearing a mask. So that's really good. So, you know, again, we hear these horror stories on the mainland. And so if you're watching COVID TV 24/7, whether it's Fox or CNA, you think that the world is falling apart. And lucky we live in Hawaii, because although, you know, 15 deaths, 16 deaths is still way too much, we're in pretty good shape compared to the rest of the country. Okay.
So I have a whole list of questions on chat. Should I just go through those to start with? I see
Sure.
Cullen raised his hand. Cullen, you
Right.
want to throw it in the chat? Is that okay, Lila? Should I just read through those?
Sure.
Okay, so the very first one came, Doug sent it over from Facebook from Iris Gushikuma Sinio. Why are ARCH2 not required to hold care conferences with family members? That was the early one. You might have seen that already.
Yeah, okay. So ARCH stands for Adult Residential Care Home. So we usually just say care home, but
Okay.
ARCH, Adult Residential Care Home. There's two types. Type 1 is 5 beds or less. The majority are type 1. Type 2 are 6 beds or more. The largest type 2 used to be Palolo Chinese Home. When Palolo Chinese Home first started, it was only a care home, but it's now care home and nursing home. So type 1 and type 2 are, care homes are under the regulations chapter 100.1. Anybody can go to the Department of Health website and they can see what the regulations are for all the different types of long-term care facilities. So when you're talking about care conferences, that's something that usually that's required for nursing homes. That's a CMS requirement. So for the care homes, care home residents are fairly independent. So somebody who's in a care home, I can feed myself, but I can't do the cooking, I can't do the shopping. I can dress myself, but I can't do the laundry. So I'm more independent than somebody who's in a nursing home, but I'm not independent enough to live by myself. So lots of times people in care homes still go out holo holo, you know, they can take the bus. So some of them go to these clubhouses, Friendship House, which is kind of treatment program, serves breakfast, lunch, and has activities for them. It's a day program. So yeah, so the requirements are different. So I'm assuming that when somebody asks about care conferences, the resident at one time was in a nursing home, improved, and is now in a care home. And so they just assumed that it would have the same regulations, and they don't. So you can look at chapter 100.1 to see what it says.
Okay. Helen had a few questions. So her first question was, when will Hawaii have testing for everyone? Mobile testing, go to senior care home facilities.
That is a question for Dr. Anderson
Big one.
or Governor Ige. Sorry,
Right.
Helen.
Okay. So then, Dale, you had one here. Oh, it's an entry on Facebook from yesterday. I don't know if you saw this, about fraudulent charges debited to an adult daughter for the death of her mother in a care home. It was COVID-19 related. $14,000 was charged for a traditional funeral, which never happened. Multiple that times many scammers, and it's easy for the Monday scoundrels. So I guess it's a statement. You know about that?
No, I haven't heard about that. But of course, you know, anytime there are charges that you have questions about, you know, first, of course, you would just ask the caregiver. It could be an honest mistake, or maybe you got the wrong bill. Maybe that letter was meant to be sent to somebody else. But if you're not satisfied with the answer, you can call up our office, or you can call up the Office of Healthcare Assurance, and they would investigate that and find out, you know, where are the receipts? When did this take place? You know, what documentation do you have to confirm that this is legitimate or not? So those things can be investigated.
Okay. And then I think, Dale, what that was also indicating is issues with scammers, other scams that are going on out there that we want to be aware of. I just expanded to that a little bit.
Well, actually, you know, a lot of times it's the residents and the families that can be scammers. You know, you have residents who go into these homes and you know, they know that if you're private pay, doors magically open up and you become first on the list. And so you get into this home and then you agree to pay $4,000 a month, $5,000 a month, whatever, and the bill comes and you don't pay. And it's not that easy to kick somebody out. I know of a facility where the resident kept saying, oh, you can't kick me out because Governor Ige said that under COVID-19, you know, nobody's allowed to be thrown out on the street. I was like, well, actually, you don't have COVID-19, and this is not really what he was talking about. And you're not being thrown out on the street. You know, you go back to wherever you came from. But we do have some seniors who think that you know, they shouldn't have to pay, and they want to give their money to their children. And so they agreed to something in order to get in, and now the poor caregiver who's still providing food and supplies and adult briefs, sometimes they're even paying for the medications for this person, and the person is not paying the bill. So I was not aware when I first started just how many caregivers get taken advantage of by residents and families. So, you know, it's a two-way street.
Right.
You'd be surprised.
Yeah.
Scammers.
I know in mental health in our nonprofit, we could not, we had to continue prescribing the meds whether we were being paid or not until somebody else picked it up. We were liable if we did not. I don't know if that plays into any of this at all.
We had, when I worked at Halinani, I was director of social services there for 7 years before I became the ombudsman in 1998. And we had families that were not giving the social security check over. So mother and daughter have direct deposit, same bank account. And we've got the mother, we're providing the care. The social security check is supposed to come to us, that's the cost share. But mother and daughter were living together. Daughter's income was not enough really to pay the rent. So she feels that even though we now have mom and are providing the care, she's still entitled to get the social security check. And if she were to ask mom, is that okay with you, mom, that I keep getting the check? Of course, mom loves her daughter and will say, oh yeah, of course you can have it. But now the facility is not getting their cost share. And so one legitimate reason for discharging somebody is if the resident is refusing to pay. So, you know, those things happen. And so, you know, no easy answer. Nobody, again, wants to kick somebody out on the street. But facilities have bills to pay, staff to pay, infrastructure, electric bills, water bills. And so everybody has to pay their fair share.
Right.
Don, can I interject? There's a question from Cullen. Cullen, I'm going to unmute you now. And after Cullen, Helen has a question too. So Cullen, you're unmuted. I'm trying to unmute you.
Okay. I just wanted to thank John for his good work, and maybe he should stick around and not retire for 20 more years. You know.
No way.
But anyway, this I just was rather disappointed with this decision by the health department to allow outside home care workers to come in, inspectors, for example, to come in with their shoes on. Culturally, it's just unacceptable, and there's also sorts of issues, even, you know, as John pointed out, with regards to the possibility of bringing infections into the home as well. But I'm wondering whether or not, John, this might be a way in which you can sort of consolidate the care home and the foster home associations to begin working on some of these issues collectively, because individually it's really hard to do that. What do you think?
I agree. You know, there's several associations, and sometimes they are competing with one another for membership, and so they don't always work well together. But this has become a hot topic, the CTA issue with the shoes. And so I know some of you, Helen was looking at John Mizuno's Facebook This is a very lively conversation. There's a lot of caregivers that are jumping in here. And so, you know, we have Keith Ridley's response, but it does say, you know, there's a little bit of a window of hope here. It does say that he is willing to work with CTA to address this. So, you know, I have not read the OSHA rules, but, you know, wearing shoes in somebody's private home, when, you know, these homes are so clean. I've been to many of them. Jackie's been to every one of them on the Hilo side. Brent's been to every one of them on Maui Island. And they're super, super clean. So there's no way that a CTA inspector is going to be stepping on something and get hurt, you know, or slip on something. They're immaculate and they want to keep it clean, and I don't blame them. And so again, with everybody focused on COVID-19 infection control, why would you now say, this is a good time to bring in dirty shoes? You know, it just doesn't make any sense to me.
We always, when I did in-home care, when I managed it, we would wear anklets basically with the little rubber soles. That's what we'd wear when we go in homes. So we'd take our shoes off and we would change those between homes. So it's fresh, but it's just something we do with in-home care. So it's pretty easily done.
Well, I would also say that, you know, it should be the responsibility of the inspector to bring their booties. So it shouldn't be that the caregiver now has to go find another thing on my list, the things that I got to go buy. You know, so if you're going to come into my house, you pull out your clean booties and you put them on your shoes. I don't know what size shoe, you got a big foot or a small foot. So you buy whatever booty you like, and then I'll let you in. So again, the caregivers in their conversations with both John Mizuno and Keith Ridley have said it's not that they're opposed to people coming in to do inspections. They're just opposed to people bringing in germs.
Right, right.
Right, Helen had her hand raised. Helen, do you want to ask your question?
Yes, it seems that because we got on lockdown, a lot of people don't know what's going on. Even our state officials and our city people don't seem like they know what the left hand or right hand is doing because of the lockdown. A lot of people are not attending the meetings to see what the decisions are. In fact, even this kind of meeting is how people are starting to become aware that their voice can be heard, and rather than how in the beginning we just were told the Capitol's closed, the city's closed, the unemployment offices, all these different ones, but we don't know how we could help until we know what's going on. Maybe you can even keep these kind of meetings open and available to the care homes, because what I'm hearing is that there's a need for gloves, there's a need for equipment, there's a need for disinfectants, masks, rapid testing kits. Because even I hear that some of the caregivers that are going there to the homes, like on the mainland, my sister's daughter-in-law came home from work early from a care home because they had detected or found that she had the coronavirus. So she brought it home, and of course she lives in a home where there's 9 people. So 3 of the 9 were tested, and their tests showed they had the virus. So this is getting bigger on the mainland. It hasn't yet affected Hawaii like New York and all the bigger ones. But unless our state officials, and I understand that Mizuno is the hearing officer for human services, that maybe he could arrange for the spokespeople for these homes to come out and tell what their needs are. Just like when the mayors from the outer islands got together on one of the LILA programs, and Kauai was saying how their needs are not heard, or even their orders for things because they're small. It seems like big orders are being filled or get the attention to be filled. So it seems like we need to get some consolidated voices so that the needs of the little homes can be addressed, especially like this fast testing that's supposed to be available. Even if the governor, and it surprises me that he hasn't addressed the president with some of these needs that are needed here in Hawaii. For instance, I understand now that there are masks being available because the people's needs were heard by the fabric shops having a hit on being able to facilitate some of the needs of face masks. So again, unless the right hand knows what the left hand needs are doing, not too much is happening. And and I'm not saying they're neglectful. It's just that we've been in lockdown. We haven't been going to meetings or to the state where there's transparencies to get the voice heard. Just like when John got complaints about the inspections, and then it went to Facebook. And now he's hearing that rather than just be general and say, okay, no more inspections, there are solutions. And that's why I think he's now willing to meet and maybe meet, where John, you should be there too, to say what's going on in these care homes, because really they have been neglected, their needs. And before it gets out of hand, somebody's got to coordinate some kind of meeting with the officials, state and government and city, because apparently
the numbers show that people who think that, well, if I get sick and I need a long-term care facility, I'm going to choose a nursing home. But you actually may not get that choice, because again, we have more beds out in the community than we have nursing home beds. And nursing homes really want people who are coming from the hospital, who have had the 3 days acute care, who are skilled nursing, because they're going to get therapy. And the reimbursement for therapy is pretty high. So nursing homes stay in business by providing as much therapy as possible. But once you've done your therapy, they really would like you to go. They don't want you to be a long-term resident, because people do run out of money, do end up on Medicaid, and that is the lowest of the reimbursements. So you might be in a nursing home for therapy, but after that, you will be kind of nudged to consider going to a foster home or an expanded care home, or if you've improved, go to a care home, but they don't really want you to stay. Helen had brought up the issue of transparency, and I thought maybe Brent could talk a little bit about, the Maui Memorial situation, because I noticed that in Sunday's paper, Kaiser took out a full-page ad, and nowhere did they say, I'm sorry, we goofed, we made some mistakes. So, it was very carefully written, but never acknowledging any faults. And yet I did see previously in the paper, people who were working at Maui who were saying that management was not really leveling with us about what was going on. And Maui only has one hospital, right? Maui Memorial is the hospital. And now it's owned by Kaiser, and Kula Hospital, the nursing home, is also owned by Kaiser. So you might have some staff going back and forth up the hill, up country. So, so maybe Brent, for people who were not following the story, if you could just do like a little recap of what happened on Maui.
Yeah, pretty much. And some of that, though, keeping in mind, as the ombudsman, I don't go to Maui Memorial as a representative. We do have a volunteer that goes up to Kula Hospital as a representative, but Maui Memorial is not included in that. I think it's just simply because of their status. Say, John, they're not considered a nursing home facility, whereas Kula Hospital really is, because they are a long-term geriatric care hospital. So basically, the only information that I have about Maui Memorial is pretty much what was in the newspapers and what was being, told, and that was simply that yes, they had an outbreak. Yes, there was some sort of confusion with the use of PPEs in the facility when the pandemic first started, and then there was an outbreak, and then Kaiser sent a task force in from their main facilities in California administration to set up basically, as I said, a base camp task force to help alleviate the situation, because as John pointed out, it is our only hospital on the island. So we're going to be in dire straits. As far as I know, at this point, they do have it under control. And they, there are several staff and patients still in isolation. There was one unfortunate woman who was there for another reason, not COVID, who came into contact with a staff member that was later determined to be positive. This is according to the newspapers. And then this woman, who's 92, ended up passing away. And that was very unfortunate. And I'm not exactly sure what Kaiser is doing to address that particular situation. I think they don't seem to be doing as much as far as public awareness goes. I would like to see them do more, is what I'm trying to say. They're, as you pointed out, John, they took out a full-page ad, but there wasn't any major apology or any reaching out to the community for assistance or apologies or explanation of what they're trying to do. On the other hand, Kula Hospital, they're doing really well. They got on it right away. Even though they are a part of Kaiser, Kaiser owns them, they have different administration and different management. They were, once the pandemic hit, they were passing out the PPEs. They were training, retraining their staff on appropriate use over the long term, because nobody was having to wear masks continuously. Whereas they were using gloves and masks when they were doing an individual treatment, but not, for their entire shift, for example. So there was extra training going on, and they have not had any cases. There's been no cases up at Kula Hospital. There was a scare where one member of the Maui Memorial staff had gone up there for some sort of training or some sort of function, and came in contact with a couple of residents and some staff from Kula, went back down to Maui Memorial, and then tested positive. So that, of course, caused an instant, alert and kind of a scare up at the hospital. They went through, they were aware of all the people that came in contact with her. They tested them, they isolated them, and they all came back negative. So there's no cases up there, although there are still some people in quarantine, and the staff member from Maui Memorial is still in quarantine and did test positive and is hopefully regaining their health. As far as anything else goes, the larger facilities over here are doing well. Halemakua, the two Halemakuas, large nursing homes that we have here are very good. I have been talking with them on a regular basis. Matter of fact, there was one resident at the Halemakua in Kahului that came into contact, had to be admitted to Maui Memorial for a certain treatment that was specific to that individual, not COVID. But while they were at Maui Memorial, did come in contact with a staff member who later tested positive. So Halemakua jumped right on that. They found out immediately. They isolated and quarantined and tested the resident that lived there, and anyone else that resident came in contact with. Everybody came back negative. So that's really good. And also there's been no cases at the Halemakua facility in Wailuku. There's been no outbreak, no scares, no cases whatsoever. And also, knock wood, there's been no cases at our foster homes. They're a little bit nervous, they're scared, they're very cautious. There's very few of them that are struggling with supplies. There's a couple that were concerned about where they were going to get their supplies of masks and gloves. And they're working on alternative sources than previous they had up until the pandemic. The rest of them are well supplied. So I'm not sure it's an ongoing developing situation. That's pretty much it, John.
Thank you.
All right, is there anyone else who has any questions?
How can we support you?
That's a good one.
Well, I think maybe letters to the editor. You know, whenever a reporter covers this type of a story, letters to the editor show that, you know, there's interest in the topic. You know, like Larry Geller wrote a very good editorial, but so far they haven't printed any responses. I don't know if people wrote anything, but, you know, when one of our fellow advocates gets something published, we all should try to jump on that issue and write a letter to the editor. It might be published, it might not be, but the more letters they get, the more they realize that, okay, this is a hot topic, so let's cover this some more.
John, Cullen here. You covered quite a number of different issues. I can't quite recall them all. I was wondering whether or not you could provide us with just a kind of a bullet point of the major things that you covered, so that in case we do want to share it with other people, we have we're not too far off course.
Sure. So I will give this to LILA, and she can pass it out to everybody who's on this. So I don't have everybody's email addresses, but I'm sure LILA does.
All right, I can do that.
We can include it in the newsletter, yeah?
Yes, you can put that. Yes, we can. So I'm going to wrap up our general meeting. It seems like going forward, and forgive me, John, I get all the names, care homes, nursing facilities, all of them mixed up because I'm a layperson. But it seems like adult care communities, from whether it's a skilled nursing facility or an independent care home, they all need to empower their care workers and change the environment they work in, have comprehensive plans to prevent and control infections. There were great ideas about maybe a mobile testing facility or a van or something like that. I even wonder if there could be vendors, if we could encourage vendors to specialize in these independent care homes. Maybe that could be a specialized business where they don't focus on the large nursing facilities, but on the small ones. Maybe they could do business that way. Anyway, mahalo to all of you for participating, and to John and your colleagues for bringing light to this very important concern. There are some of us in this group today that are part of my condo owners hui, and some of the concerns that you brought up about these communities, adult communities, also relate to condo communities. We have the same concerns. Well, everyone, stay safe. Malama pono. And I'd like to invite you all to next month's meeting, May 27th. That's a Wednesday. And it's a forum for Honolulu's mayoral candidates. So we'll send out information in our newsletter. Maybe it might be our email newsletter to all of you, inviting you to that mayoral forum. Thank you very much for attending. I'm going to end the recording now.
Okay, thank you.
Thank you.
Bye.
Stay safe.